Hey guys, my name is Dorich. I'm a nursing student. Today I'm going to show you how to do a sterile dressing change. So first we're going to gather our supplies. We have the modulator with the wound and the bandage. We have our gloves. We have our sterile dressing kit, and then we also have our hand sanitizer. After we gather our supplies, we're going to enter the patient's room. We're going to close the door for privacy. We're going to perform hand hygiene, and then we're going to identify the patient using 2 patient identifiers. And then after we do that, we're going to explain to the patient the procedure. So, Mrs. Smith, I'm going to be changing your dressing today, and I'll be cleaning up your wound. If you have any questions throughout the procedure, please let me know. And then once we do that, we're going to go ahead and begin. So first, we're going to put our gloves on, but before that, we're going to perform hand hygiene again. And then once we have our gloves on, next we're going to remove the old dressing. So we're going to make sure when we're pulling off the bandage that we're pulling it parallel to the wound so that we're not taking any excess skin off. And then we're going to examine the wound. We're just going to look for any discoloration or color changes, any odor changes, or any drainage. And once we're done examining, we're going to go ahead and take our gloves off. And then we're going to perform hand hygiene again. We're going to open up our sterile dressing kit. And then now that our kit is open, we're going to use our hands, and we're going to make sure to just grab only the sterile glove package, making sure not to touch anything else in there. And then we're going to open up the outer package. We're going to plop that onto the table, and then we're going to open up our sterile gloves. Making sure we're mindful of the 1-inch border, not breaking any sterility. Okay, and now that I have my gloves open, I'm going to go ahead and put them on. I'm going to start by grabbing one of the gloves at the wrist area, and then I'm going to work my hand into that glove. Okay, we have our glove on. We made sure not to break sterility. We're going to use 2 fingers on this hand to come into the outer cuff. And we're going to work this hand into this glove now. Also making sure that this cuff is not it's not rolled over the skin. Okay. Great, and once that's on, we're gonna go ahead and clean the wound. We have our clean hand here, and we have our dirty hand here. I'm gonna grab my cleaning sponge with my clean hand out of the dressing tray. I'm gonna drop that into the dirty hand, and then we're gonna clean the wound starting from the inside to the outside in circular motions. And once that's clean, we're gonna discard the cleaning sponge. And then with our clean hand, we're gonna grab the gauze, plop that into our dirty hand. We're gonna clean the wound from the inside to the outside in circular motions, then discard the gauze. And then next we're going to dress the wound with fresh pack of Tegaderm. We're gonna use both our hands to open up the pack here. Put this to the side. And then we're gonna place the Tegaderm right on top. We're gonna remove the outer film, and then we're going to record the time, the date and time that the dressing change was done so that we don't forget. And then after that, we're gonna go ahead and clean up our area. Taking off the sterile gloves in the middle here. Using my 2 fingers to go under the cuff here and rolling it over the gloves. Clean up my area. Discard. And then I'm gonna perform hand hygiene. And then I'm gonna go, I'm gonna make sure the patient is positioned right. I'm gonna give the patient a call light. And then I'm gonna perform hand hygiene, and I'm gonna go document the procedure. I'm gonna leave the room and document the procedure. Thanks.